everybody, I'm Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko Totten.
And welcome to
HealthTalks.
So today we're going to talk about testosterone replacement, hormone replacement. I know we did this one in the past, and I do want to do a clarification on that one because you asked me a question about contraindications, and I didn't give a full list of contraindications.
And we're talking about for male supplementation.
For male testosterone hormone replacement, So who are the people that benefit from it? Definitely if you have a decrease of energy, you have a low basal metabolic rate, meaning your metabolism is slowed down, so you're putting on weight, especially in the midline, that's usually a big clue, and decrease in libido. Those are kind of the three big ones that, kind of give you a hint that your testosterone levels are low.
And do you need to measure those?
You do, and I think, that's one of the important facts too. And a lot of patients will have a normal range testosterone, but low normal and still feel those symptoms.
Yeah.
So what do I mean by that?
Dependent on how the person responds to that level.
No, I think that when it's low, it's low, but unfortunately, a lot of the labs will say like 260 to like 900 something is normal range.
Yeah.
But if you have 900 something of testosterone, you're feeling a lot of energy. You're putting on muscle mass. You're not having an issue with a slow metabolism, but you could be 268 and be normal range and feel like crap.
Right.
You could be 300 and feel like crap.
So it's normal, but it's not normal.
Correct.
For you.
It's low normal. Well, no, it's low normal range. So here, and I say this to all my patients. If you feel like you don't have enough energy and your testosterone levels are under 500, you would benefit from some hormone replacement.
If that lack of energy isn't caused by anything else.
Correct. If you are under 400, you're really going to benefit from it. If you're under 300, it's a huge difference. I mean, it's an exponential change in how the way you're going to feel once you start taking hormone replacement. Now, you had asked me about contraindications. Last time, one of the things I forgot to mention at the time was actually testicular cancer. So there are certain cancers that you would not want to take testosterone, because just like in female hormone replacement,
of course.
If you have breast cancer, you're going to be taking estrogen. If
it
has estrogen receptor positivity, you don't want to be pushing or stimulating that cancer to grow.
Right.
It's similar with men also. So if you have a history of cancer, especially prostate or testicular cancer, I think prostate is probably the biggest of them all for testosterone. You don't want to do that. And in that case, you want to speak to your oncologist about what would be beneficial. But I would take the testosterone off the table, and certainly not just go to a hormone replacement specialist. You need to be under the care of your oncologist at that point.
Yes,
So the next question is, well, what's a normal dose of testosterone? What are the routes I can take it? Right. So you can either do an injectable, or you can do a cream, or you can do an implant.
Okay.
So what are the differences there? If you're doing a cream, I don't recommend doing it if you're going to be around young children.
Right. Because if that cream touches the kids, or even like touches your pets.
That's true
too. It can affect them.
Exactly. So if you're going to be around young children, don't do a cream. You need to do an injectable or a pellet. Yeah. Now, injectable versus pellet. You don't want to jump into a pellet right away, because you need to titrate the dose to try and find out what the right dose is for you. So for all comers, it's probably better to start with an injectable, find out exactly how much you need every week or every other week, what that dosing is going to be to get you into a normal range. And what do I mean by normal range? For me, it's 600 to 900. Right. That's kind of the sweet spot. I've been doing this for a long time. Right. Patients who are in that range are very happy.
They feel good.
They feel good. They really do. Yeah. And you'll know you're putting on more muscle. You've got more energy. That's the sweet spot. Now, this isn't backroom gym, horse testosterone that you're getting from, Rocco in the alley. This is actually, real hormone replacement monitored by a physician, a specialist in hormone replacement, and you need to have your blood work monitored. So typically,
how often does that happen? Like, how often typically are the injections? How often typically are the blood work?
So typically, you're going to do either every week or every other week. I kind of like doing every week if it's the right dosing. You can spread it out, and you need to have that first couple months each month until you get into the right range, until we've dialed it in, because you also have to look at estrogen levels. As you know, testosterone breaks down into estrogen, and estrogen, causes the man boobs, which you don't want, gynecomastia.
Probably not.
So you want to keep the estrogen levels low. So typically, I'll give an injectable testosterone with an anastrozole, which is an estrogen suppressor, in combination to try to keep the estrogen levels
within that injection.
Within the one injection. And then we'll get blood work at 1 month, see how you're doing, adjust the dose if we need to, repeat the blood work again, and then once we get that fine-tuned, you go 3 months, 6 months, because now we're in a good place. And now, if it's an option to do an implant, you've dialed it in, so you know what the dosing is, and you can actually go.
So talk to me about the implant. How often do you have to put the implant in? And I mean, there must be something like if somebody's not tolerating it well, you can't really take that implant out, can you?
You can, but once again, that's why I recommend if you're going to go for an implant, you have to first have started on an injectable.
Know where you are.
You know what the dosing is going to be. Not all implants are created equal, and some can release too much testosterone at one time. So there's some controversy about which ones are the best implants to use. But I think from a more comfortable standpoint, a lot of my patients are just very comfortable doing the injections. They can stop it at any time. They're not worried about what they have in their body, and it can be adjusted regularly. So once again, contraindications are a history of cancer, prostate cancer, testicular cancer. Speak to your oncologist before you certainly go on hormone replacement. You do want to be careful about testicular atrophy. So if you're on testosterone replacement, you should be doing testicular examinations regularly, just like women should be doing breast examinations. If you find any testicular atrophy, there are medications that help prevent that or even reverse it. So you just want to be aware of those things when you're on hormone replacement. And I think the takeaway from that is, once again, you want to have somebody, a doctor who specializes in hormone replacement, so they know what they're doing and they can help guide you. And
make sure you get followed, make sure you get the proper care, the proper follow-up.
Exactly. And you want to feel good. You want to be feeling better. If you're not feeling any better, there's no point in doing it at that point.
And that's always, with any kind of medications or hormones, you want to look at your quality of life versus risks.
Absolutely.
And if your quality of life is improving and the risks are low, this might be something that you can consider if you're not feeling well.
Exactly. As always, if you have any questions, please reach out to us. Happy to help you. And I'm Dr. Michael Nusbaum.
Dr. Daria, Klachko, Totten.
And thanks for joining us at Health Talks.
Thank you. Bye.
Bye.